So once you're in SharePoint, you'll need to go here to select the county of the client that you're working with. So for the purposes of this demonstration, we'll click on Metcalfe County. And then you'll need to go to part 2 and select the client code. So you'll notice when you pull this up that for each client code, we have a 0, a 1, and a 2 after their actual code. This is because we're actually collecting data from 3 points of time. So the 0 is baseline, 1 is the 6-month assessment, and 2 is the 12-month assessment. So you'll see this for every client. So I'm going to go ahead and select a client where I know we don't have any information in SharePoint yet. So I'm going to do MC012_0, which would be client with that we're collecting baseline data for. So then once you click on that, you actually have to go click on one of the tabs as well for the information to populate. So I always suggest that when you begin working with a new client that you click the Progress tab first, and then underneath this, I would suggest putting the case conceptualization date once you have that information, and then the actual date of the information or that you collected for the assessment. So if I click here and then I click on here, if I'm doing an assessment, let's say March 29th, and I click Save, and I'll be collecting that information so I can keep track of the clients. Directly underneath the dates that you need to input on the Progress tab, you'll see there's a series of questions that you also need to include. So these are related to the signatures that are on the enrollment packet and on the informed consent. So remember that the intake packet is the enrollment packet that we have clients fill out to indicate that they are willing to participate in services through Flourish. So you need to make sure that they sign that page and indicate so here as well. And you'll see that next to each of these, there's a drop down that says no, yes, unable to answer, refuse to answer. Then underneath that, you'll see consent signed by patient. Remember, in addition to the enrollment consent to receive services, they also consent to being part of the evaluation of our study. And so they have to sign that informed consent that's through the IRB. Then you need to make sure that you, as the health navigator, that you're signing the consent if you are the person that explained the consent to them. So that can be either the community organizer or the health navigator signing the consent. You do have to have IRB approval to do that, and all of you have received that training. Then underneath that, you'll see that the PI actually has to sign the consent form as well, and that would be Dr. Yankee Love, because she's the PI for the evaluation part of the grant. And technically, she's supposed to sign this document within, I believe, 2 weeks of you obtaining this information from the client. So once that has been signed by her in the Progress tab, it'll have to be changed to yes as well. And then if the client has a caregiver, that information will need to be input as well. And then, of course, always hit save. Okay, so then once we get to the Enrollment tab, you'll see underneath Enrollment we have contact details, emergency contacts, demographics, employment income, living situation, services. So you first begin by filling out the client's name. We're going to call her Jane Doe, and she lives on 100 Happy Street in Metcalfe County, Kentucky. And then you would just fill out the rest of the information from here. This looks exactly like the demographics page looks on the enrollment packet, so this is that same information. Then if you go to emergency contacts, that's pretty self-explanatory. It's going to be the whoever the individual that we're working with identifies as their emergency contact. You'll also see there's a place here to put your doctor information. So we have the primary care doctor, their information, telephone, and any other doctors. Now if you have a client that you're working with that has more than 3 doctors, I would suggest that you include that information in a list under notes. So once again, if you add anything to any tab within enrollment, you need to hit save. It's not going to save automatically. And you see on the page that there are two places to hit save. There's a save at the top and a save at the bottom. It does not matter which one you hit. So then here once again, we have all the information. We can say this person's female, that they're white, preferred language, English. And then we have all the other questions to fill out for this, but I'm just going through to show you how to use this. So as you go through the assessment, what you do is just click from tab to tab and make sure that anytime you hit add in any information, you hit save. Save goes for living, situation, and services. Now, once you've done the enrollment information, which is pretty much that information that was on the enrollment packet that we created, then you need to move to assessment 1. So to get from enrollment to there, after you've completed all of these sub-tabs that are under enrollment, you just need to click on assessment 1. And then you would just go through each of these sub-tabs under assessment 1, and they pretty much flow the same way as the part 1 of the geriatric assessment that we had in the packets that you've been doing on paper. So it should flow in the same way. You just need to make sure that you click on each of these tabs and fill it out. The one thing I do want to show you is that when you're in medications, when you're inputting this information, you'll go through and put in medication strength formulation and go through and fill out all of this part of the assessment. But then after each one, you hit save. And then to do a new one, to add a new medication, you just click the button that is the it looks like a forward button almost with a yellow dot next to it, and that will populate a new place for you to type a second medication, and you can input as many as you want in this. And then I'll skip the rest of this because it pretty much follows the assessment. If you go to assessment 2, this is the same as before. You'll see all of the same measures that we had on assessment 2, and you'll just need to click through each one of them. Medical records, now this is going to be any information. The first part is the actual assessment that you ask them to take, where you ask them questions about their medication habits. Then we have any clinical measures. Then we have the information from the chart file review. So we have if anybody has any of these current diagnoses, and then if they've ever had them before. And then number of hospital stays. So then the note tab is if there's any type of, well, it can be used for a number of different ways. So one, if there's something on the assessment that the client doesn't feel comfortable answering, so that field is going to be blank in the assessment. Before you would have just written on the piece of paper saying did not want to fill out or didn't know the answer to this question. Here you can actually put a note in and tell us that that individual refused to answer the question or they refused to participate in that particular assessment. So what you need to do is when you click on Notes and Records, you would obviously click this tab first, and then you would click Notes here. So you probably saw the screen shortly before I clicked Notes where it was just looked like it was loading. It's going to keep doing that unless you click on Notes.